Imagine waking up with a mysterious rash. You start to panic. Is it monkeypox? In this video, we're going to break down everything you need to know about monkeypox, or as it's now called, Mpox. We'll discuss what it is, its symptoms, debunk some common myths, and explore how to prevent and treat it. Let's get the facts straight. If you find this video helpful, don't forget to like and share it with others who might benefit from this information. Mpox, formerly known as monkeypox, is a viral illness caused by the monkeypox virus, which belongs to the orthopox virus genus. This virus has two main genetic types, clade 1 and clade 2. While Mpox was once a rare disease primarily seen in Central and West Africa, a global outbreak occurred between 2022 and 2023, mainly driven by the clade 2b strain. The virus can spread from person to person through direct contact with infectious lesions, bodily fluids, or even respiratory droplets during prolonged face-to-face contact. Additionally, Mpox can be transmitted from animals to humans or through contact with contaminated materials like clothing or bedding. The symptoms of Mpox typically begin within a week of exposure, though they can take up to 21 days to appear. The illness often starts with a rash that can appear anywhere on the body, including the face, hands, feet, mouth, and genitals. The rash begins as flat sores that evolve into blisters filled with liquid. These blisters eventually dry up, crust over, and fall off. Other common symptoms include fever, headache, muscle aches, back pain, swollen lymph nodes, and a general feeling of low energy. The infection can last between 2 to 4 weeks, and during this time, an individual is infectious and can spread the virus to others. There are several myths surrounding Mpox that need to be debunked. First, Mpox is not a disease that affects only specific groups of people, such as men who have sex with men. While the 2022 outbreak primarily impacted this group, anyone can contract Mpox through close contact with an infected person or contaminated objects. Another myth is that Mpox is a new disease. In reality, the virus was first discovered in 1958 and the first human case was reported in 1970. Additionally, Mpox is not a sexually transmitted infection, though it can spread through intimate contact, including sex. Preventing Mpox involves several important steps. Avoid close contact with anyone who has Mpox, and refrain from touching objects they've used. Frequent hand washing, using hand sanitizer, and wearing a mask can also help reduce the risk of transmission. If you suspect you have Mpox, it's crucial to inform anyone you've been in close contact with, and to isolate yourself until all lesions have healed. Vaccination is a key preventive measure, especially for those at higher risk, such as healthcare workers and individuals with multiple sexual partners. Vaccines developed for smallpox have been shown to be effective against Mpox as well. If administered within 4 days of exposure, these vaccines can help prevent infection. In terms of treatment, there is no specific cure for Mpox, but the focus is on managing symptoms and preventing complications. This includes keeping the rash clean and dry, taking pain relievers, and staying hydrated. In some cases, antiviral medications like tecovirimat, initially developed for smallpox, may be used to treat Mpox. Mpox is a serious viral illness, but with the right information and precautions, it can be managed effectively. Remember, anyone can contract Mpox, so it's important to stay informed, practice good hygiene, and seek medical attention if you suspect you've been exposed. By debunking myths and understanding the facts, we can all play a role in preventing the spread of this disease. Stay safe and informed. And if you found this video helpful, make sure to like, share, and subscribe for more content like this.